and more. Hi, thanks for joining us. I'm Dave Elliott, and we're going to start with the medical aspect. Joining us, Singing River Health System Chief Medical Officer, Dr. Randy Roth. Thank you so much, Dr. Roth. I hate to drag you into this right off the top, but I'm curious what you think. The politicians are wrestling with this reopening and restarting the economy amid this health crisis. Personally, I put more faith in the scientists and doctors like you when it comes to developing protocols and best practices so we don't jump the gun and have unintended consequences. What are your thoughts on that generally?
I think eventually we got to get back to some time of normal. I hope it's maybe a little bit later down the road. I think essential things need to get back on the schedule. We're going to start doing some time-sensitive and elective surgeries here on Monday and Tuesday of next week. The surgeons need that. These patients have been waiting to get these things done. We're going to screen very effectively and thoroughly and get people into the hospital and out of the hospital safely. But I think at some point we have to slowly reintroduce back to normal. I don't know what that's going to totally look like, but
well, what about doing that with safety and and caution in mind, though?
Absolutely. And for us, we're going to spend a lot of time with the visitor policy for our elective surgeries, who's going to be allowed to come in, who's going to be allowed to stay, and we're going to make sure we do it in the safest way possible.
At Singing River, or relative to what you know about the situation with hospitals in Mississippi in general, not according to the models or the projections, but real-time conditions, are you concerned that we're being pushed to the brink when it comes to availability of PPE, hospital beds, ventilators, ICU beds?
No, I think we're fine with hospital beds and ventilators currently. The PPE issue is very specific to the hospital or the nursing home that you're at. We have been very prudent with our PPE, but we have not had any cases where we've run out of it, where we can't protect our employees, our doctors, and our nurses. We're fine with ventilators. We're fine with hospital beds. I'm not saying that we've plateaued yet, but we certainly are getting to a point where I'm beginning to see a little bit of light at the end of the tunnel in terms of the number of cases that we have.
There's a lot of attention right now on this antibody testing. Who had it? That's the big question. Who might be immune? And a second question, a lot of people debate whether back in December or January, if folks tested positive with the flu or even had a bad cold, that they may have had some version of the coronavirus. What are your thoughts on that, and what could we learn from that?
The thing about this is it's called novel coronavirus for a reason. It was new to us. I don't think this had anything to do with a lack of preparation. It was a new entity that was brought to the United States. The antibody test is going to be great when it's perfected. It's very early on. It's very embryonic, and it's research now. I think we're going to do some antibody testing. We have done a little bit already. We're going to wait for it to at least get a little bit more data out there and how we can interpret those numbers. To find out whether someone's acutely ill, we have the test, the 4-hour turnaround test now. But the immunity part and the IgG and the IgM, a little more time and research needs to go into that in the interpretation of those results.
The big three right now, test, trace, isolate. That's what we keep hearing in terms of getting a handle on this thing. The difficulty is if, let's say, 50% of the people are asymptomatic and we're only testing people with symptoms, how can we possibly get a handle on the true extent of who carriers are?
And that's a great point. I don't think anybody knows the answer to that. Right now, we're limited on how we can test by our resources. It's not a cheap test. It's not very expensive, but it's not cheap. And there's only so many of these kits that are being provided to the people on the front line. So when we first started battling this disease 8-9 weeks ago, we were very limited in A, how many kits we had, and B, the turnaround time back then was 3 days. Now we have the ability to run a 4-hour turnaround time test about 4 or 5 times a day, or 3 or 4 times a day. So it's all about resources. I do think as we get better resources and we test more, I think a couple of things will become clear. I think the mortality is going to drop because our numerator and denominator are going to change. And as we test a lot of the walking well, it's going to make the mortality numbers just a little bit smaller. Because you're exactly right. Right now, if you come to the hospital and you don't feel good and you get tested, we're not testing the people that are staying home and feeling pretty good.
There's this revelation now bubbling about the so-called second wave, maybe coming in the fall, or that the coronavirus could even become some kind of seasonal event. According to what you're aware of and what you've been reading, what do you think about that?
I think clearly we're going to be dealing with coronavirus moving forward for a while. It's not going to go away. I think the cases are going to decrease. I think if we get a vaccine that's FDA approved by the fall, that will be a game changer, where I think we can vaccinate. Hopefully everybody will take the vaccine and keep those numbers a lot decreased compared to what we're seeing now. The other surge I'm worried about is people relaxing their hygiene, their hand hygiene, their travel, their church going, and we all congregate again, and we see a surge summer or fall. I think we're going to have a new norm moving forward. I think we're going to have different visitor policies. I think we're going to do things differently because we learned a lot from this virus. But I am worried about a second surge. That's why I think we need to reintroduce back to normal a little bit slowly and a little bit more planned out.
According to the CDC, these are some of the numbers. 45% of hospitalizations, 53% of ICU admission, 80% of deaths are Americans 65 or older. And then when you throw in the underlying health conditions, those numbers go even higher. But people who don't fall into those categories shouldn't let their guard down, right?
Correct. It's clear that this disease preys on the elderly. It preys on the folks that have a lot of comorbids like chronic kidney disease, diabetes, obesity, hypertension. But we've had a couple of cases of 40 and 45-year-olds that are pretty sick, needing to be hospitalized and even in the ICU. So as we go back to a new normal, we have to think about our special patient populations like the elderly, the nursing home folks, chemotherapy patients, and how we reintroduce them back into the normal lifestyle of society. Honestly, I have not seen a lot of healthy 30, 40, 50-year-olds get this disease, although we've had a couple. And there's really not a disease at all in the pediatric population that we've seen here.
And finally, Dr. Roth, throughout this ordeal, there's been a lot of chatter back and forth regarding the public wearing face masks. We understand the health professionals and those on the front lines. We'd like to see those in the grocery stores and convenience stores wearing them, the workers. But just me, for instance, when I go out, or anyone else watching us right now, what's your general rule about face masks?
Clearly, I wear mine in the hospital when I'm in any patient care area. If you're going to be in an environment where you could have close contact, a foot, 2 feet away from someone who may reach out to touch you, shake your hand, cough or sneeze in your presence, I think a mask is appropriate. You mentioned supermarkets. You mentioned maybe if you would go into a Walmart type environment. I think that place would be a good place to wear a mask if you have one. I think wearing a mask when you're in open spaces, walking down the beach or walking down your street, I don't think that's probably going to hurt. How much benefit you're going to get, I don't know. The most important thing is if you're a known COVID positive patient or you're exposed to one or live intimately with one, those folks should be wearing a mask anywhere they go for quite a long time. Several days to weeks after the last symptoms.
All right. I wish we had more time. Dr. Randy Roth, always appreciate your insight. Thanks for being with us.
Thank you.